Hello everyone, I'm Kibin Alleyne and today is Tuesday, October 22nd. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In the month of October, medical professionals observe Breast Cancer Awareness Month. With a prevalence of 1 in 8 women, early detection is crucial for the successful treatment of breast cancer. Montefiore Einstein's Comprehensive Cancer Center is actively engaged in promoting awareness regarding the significance of early detection. Nurse practitioner Elaine Matos joined me to discuss. Thank you so much for joining me, Elaine.
Thank you for having me.
Now, I talked a little bit about, 1 in 8 women are likely to be diagnosed with breast cancer. Can you tell us a little bit more about that statistic, especially when we look at places like the Bronx?
Yeah, so as you said, an average woman has about a 13% lifetime risk of developing breast cancer, which is 1 in 8. Unfortunately, in the Bronx, we do see a much higher incidence of late-stage disease at presentation. So we're hoping to change that through screening because we know that screening really allows for early detection. And with early detection, we can cure and treat breast cancer. Oftentimes, we can even minimize the intensity of treatment when detected early.
Now, I also want to kind of emphasize the importance of early detection. I think that, at least from my point of view, as we talk about breast cancer, the idea of, what we can do is changing. And a lot of healthcare professionals are really pointing out the fact that early detection is crucial. Can you just kind of emphasize the importance of that?
Yeah, so early detection, particularly in breast cancer, completely changes the prognosis for the patient. We know that if we treat a breast cancer early, a woman has a 99% 5-year survival. So that's incredible. And through screening, we're able to detect breast cancers at their earliest stages and really intervene a lot less aggressively than we may need to if a woman waits until she has a symptom like a lump before she presents for testing.
Now, I want to talk about mammograms. I know that many of us, we've heard things about it and we have ideas about it. Can you explain, what a mammogram is and how it's performed? And also some ways that we can kind of get away from that stigma that there's like this scary procedure that happens. Can you, explain what goes on when you get a mammogram?
Yeah, so a mammogram is an x-ray of the breast tissue, and it's done on a special machine that applies compression to the breast and allows for us to look for changes in the normal breast tissue. There are a lot of misconceptions about mammograms and that they're extremely painful. Most women will tell you that they're, really well tolerated. The test itself only takes a couple of minutes. The information that it provides can be literally life-changing because mammograms allow for us to detect changes in the breast tissue, very early stages. And as I said, when you intervene early, the prognosis is excellent for a patient.
Now, can you talk about how, with the advancement of technology, it has made things like screening or, mammograms a little bit easier for patients and, for healthcare professionals?
Yeah, so we predominantly do 3D mammography now. So a 3D mammogram provides pictures from different angles and is better at detecting smaller masses, particularly in dense breast tissue. So about 50% of women have what we would consider to be dense breast tissue, which can sometimes make it hard to see a small mass on imaging. 3D mammos do a better job at detecting that. And they also, some of the testing allows for images to be taken with a little bit less compression. There are also self-compressing machines where the patient can do the compression themselves, which makes it more comfortable.
Wow. Now, I want to talk a little bit, now that we're on the topic of technology, I've been hearing a lot that AI can also impact, early detection. Can you tell me what you know about that, or what do you hope to see for the future of that?
Well, the equipment that we use now, the radiologists, of course, review all of the imaging and look for changes, but there is also computer technology that's used to detect changes in the breast tissue as the radiologist is reviewing it. So we're sort of already on the path of using technology to further aid the doctors in detecting change in tissue.
Now, what is DCIS and why is it significant in the context of breast cancer screening?
DCIS stands for ductal carcinoma in situ, and that is stage 0 breast cancer. So it's the earliest that we can detect a cancer in the breast. And the reason that screening is so crucial for DCIS is because oftentimes DCIS appears as tiny little dots on a mammogram. There's no mass that's felt by the patient, and there's no mass that's seen on imaging. So without the mammogram, we would not see those changes. The patient doesn't have symptoms, they don't have a lump. And when we intervene, when a patient has DCIS, their prognosis is excellent, and we can do a lot less aggressive treatment.
Now, I want to know, when you say early detection, that means before there's even a lump there, correct?
Yeah, so for DCIS, generally it presents as changes that are only seen on imaging, not a lump that a patient feels, not a lump that we see on imaging.
Now, I want to point that out because I know for a long time, a lot of women and girls or people with breasts were told, to check for lumps. So, if you don't have that, or if you want to, get to that before the lump appears, how do you know that you should begin screening, or you may be somebody who should look into that if you don't have a lump or you're checking before that happens?
So I think it's two-part. I think that it's important for a woman to always be, for patients in general, but specifically to breast cancer, for a woman to be aware of their breast tissue. I think it's important to be aware of any change that you note, and if there's anything that you detect, of course, see your provider for an exam. As far as screening goes, all women should be screened at age 40, and then they should have a screening mammogram annually. Those are the guidelines that we follow, and those are the recommendations that we make. That's regardless of family history. An average woman begins screening at age 40. For people that are at higher risk because of a genetic mutation or because of an increased family history, then they may begin screening even sooner.
And then when we talk about higher risk, does that, pertain to maybe racial, ethnic backgrounds, socioeconomic status? What would put somebody at higher risk?
Putting somebody at higher risk is generally related to family history, so particularly breast and ovarian cancer, or if they carry a genetic mutation that predisposes them to developing cancer at a much higher rate than the average woman, or if they've had a biopsy that has showed atypical cells or something called LCIS in the past, then that would increase their risk of developing a future cancer.
Now, what should women do, to prepare for possibly, getting screened? And, when I say what they should do, that could also be mentally, because I know that whenever we're talking about health, that could cause a lot of stress. So, what should people do when they're in preparation for this?
So the test itself, as I said, only takes a couple of minutes. As far as specific test prep, we don't want you to wear any lotion, any deodorant. That actually can affect the image quality. So those are things that you would not put on day of mammogram. Comfortable clothing, and then just go into the exam as relaxed as possible and prepare for a few minutes of mild discomfort.
Now, I understand there's also a misconception that mammograms, because there's technology involved, that it could cause cancer, or people have a lot of fears surrounding this. Can you set the record straight right now?
Yes, so mammogram does emit a low dose radiation, but the benefits of detecting a cancer far outweigh the risks of the low dose radiation exposure. So I would encourage all women once a year to have their screening mammogram.
Now, how can women advocate for their health regarding breast cancer screenings?
I would say when a woman approaches the age of 40, they should have a conversation with their provider about scheduling their screening mammogram. I would keep their provider updated on any changes to their personal or their family history, particularly with breast and ovarian cancer. And I would speak to your doctor about breast density once you have a screening mammogram. And if you're reported to have dense breasts, then possibly add in a screening ultrasound as well.
Now, I know for a lot of younger generations, people are a little bit more fearful or just a little bit more conscious about their health. If they are interested in it, what are some methods that they can do to kind of take care of themselves now or prepare themselves for when they are eligible to be screened?
Again, I would have a conversation with your provider. I would assess risk and see if screening is necessary at an earlier age based on risk. And if not, then I would begin your screening at age 40. And I would have your screening annually.
Now, what are some resources Montefiore Einstein provides to support patients during the screening process?
So we actually have BOLD, which is Bronx Oncology Living Daily, and those are cancer survivors and volunteers that can accompany patients, particularly patients that are fearful of going to have their screening study. Montefiore offers many sites where they do screening mammography. Several of those sites have diagnostic testing. also available there. So if there's a finding, you don't need to go to another location. The entire workup can take place in one spot, which is convenient for the patient. And we also offer a lot of free screening events throughout the year. So for patients that are uninsured or underinsured, or perhaps have insurance but just missed their mammogram that year, they're welcome to come to these screening events and have their mammogram.
Now, where can people go to find out more about these screening events, especially the ones that are free?
So you can call the Montefiore Einstein Breast Care Center. It's also available on our website. And there's also flyers that are usually posted throughout Montefiore to let people know when these events are upcoming.
Well, Elaine, I want to thank you so much for joining us, just for having this conversation. One, because it is needed, especially in the Bronx, where we see so many people just struggle with so many different health challenges. So one, I want to thank you for that. And then I also want to thank you for returning to BronxNet and, educating our community as you always do. So once again, thank you so much.
Thank you so much for having me.
For more information on breast cancer and screenings, visit the Montefiore Einstein Breast Cancer Center website that appears on the screen below. Stay tuned. We'll be back with more Open right after this.